And also how in this situation, and when it been start for you, and how you take handle the situation. The people go like hear from you directly.
Okay, thank you so much for your questions. Fantastic questions. So, in 2001, I think I had a routine scan, and the doctor said that I had uterine fibroids, but they were really tiny and they were nothing to worry about. And I was supposed to just watch and wait. So the doctor said, adopt the watch and wait strategy, and that was it. And then subsequently in 2005, I went back to my doctor. Um, I needed, because I realized that my bleeding had increased during my periods, and I wasn't happy about that. So I went to see my doctor. So the doctor said, "Oh wow, you remember we said that you had these fibroids in 2001. Now they've come back. I mean, they've grown bigger, and they are now disturbing your periods, and you need to get rid of them." So I said, "Oh really?" The doctor said, "You have to, the only option that you have is surgery." And he described the surgery. He said it was called a myomectomy, and that the size of my fibroids were really, they were really large, and nothing else would work, and that I should just opt for the surgery. So in 2007, eventually, when I could not bear it anymore because the bleeding was very, very, very heavy, I was in a lot of pain. I was, really stressed. I was always anemic, constantly anemic. I was almost like I didn't have blood at all. So I had to, succumb to the surgery. And so I had surgery in 2007. And then in 2013, I needed another surgery because,
Wow.
The fibroids had grown back again. I think that was because I'd gotten married, and I took this tablet that sort of helps with ovulation, and it's an over-the-counter drug in a lot of a prescription drug in a lot of countries, but in Nigeria, it's an over-the-counter drug. So you can go to your pharmacy and just ask for that particular drug. A lot of people know it. I don't know if I should mention it.
No names yet.
Okay. Right? So I took that, and then next thing I realized that my stomach started growing again. And unfortunately, when I actually read the contraindications for the medication, said that if you've had fibroids before, you need to take it with the supervision of your gynae doctor. But I didn't really, when you think that, what are the odds that this thing will be speaking to me? I didn't really think anything about it. I just decided that it wasn't going to affect me. Yeah. So I took this medication. It was one dosage. I think it was about maybe 6 or 8 tablets.
Okay.
I took the complete dose. And in the next month, my stomach had started growing, and I was looking very heavy and very pregnant, but I wasn't pregnant. And eventually, the doctor said, "Oh, your fibroids have grown back again." So I said, "Oh, you didn't tell me that they could grow back again." They said, "Well, they could grow back again."
Wow.
So that's how I found out fibroids actually grow back again, because the doctor actually didn't tell me. I thought that once I got rid of them the first time, it was not going to come back again. So that's how I realized that I had fibroids again. And then in 2013, when I couldn't bear the pressure anymore, I had to opt in for another surgery. Now, 6 weeks after that second surgery, I had to have another surgery for a different condition, but that was related to the fibroids, a cyst in my kidney. Right?
A cyst?
And the doctor said, "Oh, yes, a cyst." So now it's going to be, I don't want to complicate the matters, but, the doctors actually linked it to the fibroids, right?
Yeah.
And so by right after that second surgery, I needed a surgery to correct that issue with the kidney. And then, you have to have a preoperative test or checks. When I was doing those checks, the sonographer, the person taking the scan, said, "Oh, you have a lot of fibroids." And I said, "No, come off it. It's not possible. I had surgery 6 weeks ago at the hospital next to you. There's no chance that I would have fibroids." The doctor said, "Well, you do have fibroids." And lo and behold, that's how I started battling with, dealing with fibroids again, 6 weeks after a myomectomy to remove fibroids. And that was when I realized that, no, I wasn't just going to leave the doctors to decide my fate. I had to decide by myself. I had to research into the causes of these fibroids. Why am I getting them? Why am I growing them so quickly? Even the doctor said that the ones that I had were quite aggressive. And so I decided that I was supposed to be my own health advocate right from then. And I started researching, I started checking. And then I realized that actually I shouldn't have needed this many surgeries. The reason that the first and second time the fibroids grew back again was because of the procedure that the doctors used. So I went through a procedure which was called a myomectomy. But the doctors that were dealing with me gave me an injection called Zoladex. It's in a family of GnRH analogs, they call them, and they're supposed to shrink tumors, right? That's the work of the Zoladex.
Yes.
So with Zoladex or Lupron, or in that family, but they call them GnRH analogs, right? People with cancer also, they doctors use it to treat cancer. They use it to treat any kind of tumor, abnormal tumor in the body. So with this Zoladex, what would happen would be that the fibroids will shrink, right? The essence is to shrink the fibroids so that during surgery, they can minimize blood loss. They don't want the patient to lose too much blood, because obviously the fibroid surgery is a very bloody, you have a lot of blood, a lot of arteries supplying a lot of blood vessels supplying or feeding the fibroids.
Yeah.
If you don't do it right, the woman may bleed to death. So they try to minimize blood loss, right? That was the essence of giving me the Zoladex. But what I realized was that 3 months after, so I had to take 1 injection per month for 3 months, right? And after 3 months, I had the surgery. And what I realized was that once I went into theater, just before I went, my stomach was always flat. This was from me looking like I was maybe 6, 7, sometimes even 8 months pregnant, like I was ready to have a baby.
Wow.
To my stomach being flat just within 3 months. In fact, one time I said to the doctor that, "Doctor, I don't need surgery anymore. These fibroids have gone, they've disappeared." The doctor said, "Don't be fooled. The injection that we gave you was just to shrink the fibroids. And if you stop taking that medication, the fibroids will grow back again." So I said, okay. So I went into surgery, right? So, but what happened was that during surgery, I think those fibroids were so tiny, some were really small, and the doctors either did not see them or they just felt that they were not important. They were really small and they were insignificant. So they ignored them or left them behind. And lo and behold, right after the surgery, the fibroids have a tendency of growing back again.
Wow.
So that was the reason that mine grew twice. So if there's anyone out there that is that the doctors are advising to use that medication, you have to be sure that it's a doctor that understands that they have to get rid of all the fibroids. So even if they use the medication for you, they have to make sure that even the tiny fibroids they have to take out. They must not leave any behind. Otherwise, it's a wasted effort. Surgery, really.
All right. So I see so many questions trooping in actually, but Mark will take a break. Once I come back on this break, then we'll start answering these questions. And someone is already screaming that wow, so you had to go through all this and back again. And she said she also had the same experience with her own fibroid. She took it out and then they're telling her to take it out the second time. She would love to hear what you want to say concerning that matter. When they come back, Health Corner, guys, send your questions, and the ones where you don't drop on top of our social media platform, Wazobia FM Lagos, for that particular post, I go pick them up also for you to answer. When they come back, no touch your dial. Lagos, welcome back. We're still there here for you. 17 minutes, don't work past the hour of 5 o'clock. Now, still health corner. And then I see plenty of questions where you there ask. And we still get the expert herself concerning gynae issues. We get Oyinkan Ogundele live with us virtually inside the studio. Oyinkan, welcome back. And welcome back. Will be the take just to get a little bit of what you go through and all the things then we say you go through. But the people can't wait. They throw their questions back to back. Somebody they ask you, we'll take 2 questions and we'll return back to you to give us more insight. Somebody they ask, say, is there really what in they cause this fibroid? What in doctor tell you say they cause this particular fibroid?
Okay, so doctors have actually not told us specifically what causes it, right? They haven't really, we haven't done that much research to be specific that this is what causes it. But there are several factors that they think could contribute to, women developing fibroids. One of them includes the genetic predisposition. The fact that your mother had it means that you could also have it. If a mother has had it, like my mother had it, and so when I, had fibroids, the doctor said, "Oh, did your mother have it?" And obviously, because my mother had it, they said I had a tendency of growing fibroids. Now, the other factor is that, being black, our skin tone, our color, also predisposes us to, growing fibroids. So African women, Africans, Caribbeans, Black Americans actually grow them bigger and more. So in a room, if you have a room full of women, let's say a room with about 100 women, if you check every woman of the 100, maybe you would have 80 of them with fibroids, or maybe even 90.
That's huge, man.
It would affect people differently. Yes, it's something that affects, they say 1 in 6, but, I think the statistics should actually be 8 in 10 women.
8 in 10, huh?
Yes, 8 in 10 women have fibroids. Africans, 80% of African women have fibroids. A lot of them would not know because they don't present with any symptoms. So some people will be asymptomatic, but most people find out that they have fibroids when they go to the hospital, when they are pregnant.
Yes.
And they go to the hospital for a scan. And the sonographer will say, "Oh, I see 1 fibroid or 2 fibroids." But sometimes it doesn't grow bigger than that, and it just stays as it is. But if you have one that is problematic, that starts giving you excessive bleeding, especially the type that is in the lining of the womb, then it will cause you a lot of problems. And, in that case, you cannot, overlook it. You have to find a solution to it, because mine were really bad. I was just always bleeding. I say that I can liken myself to the woman with the issue of blood. And I must tell you, I didn't finish the story earlier on.
Yes.
I actually needed a 3rd surgery after the second. Remember that I said right after my 2nd surgery,
yes,
6 weeks after, the doctor told me that I needed a 3rd surgery, and I was like, "Come on, guys, what can I do now? Am I allowed to speak pidgin here?
Yes.
Who I offend? What can I do?"
Yes.
I started asking questions like, why am I growing these things? Why do I need a 3rd surgery 6 weeks after a myomectomy? Then, I realized that, there was a problem, and I had to take up my own health into my own hands and start finding, the solution by myself without just fully depending.
So Oyinkan, what be this solution where you find? Tell us this solution where you find. Briefly. Don't go. Okay, go ahead.
The solution was that I still needed, at the time, I was still advised that I needed surgery.
Yes.
But I made sure that I didn't go through the type of process that I went through the first 2 times. I found a doctor who understood what fibroids were.
Yes.
And who could do a proper surgery without having to use those injections that I mentioned earlier, the
yes,
Kulele injections.
Yes.
Because those injections were the ones that were shrinking the fibroids so much that doctors didn't see all of them to take out, and they left some behind.
Wow.
And those ones grew back.
So
now, thankfully, people are talking about other means of getting rid of fibroids apart from surgery. I'm researching into something called uterine fibroid embolization. I don't know if I can start recommending it yet, but I'm doing some research to understand, how effective, how safe it is. Maybe, women, may not really need to do surgery like I had.
Yes.
But that's something that we can discuss at a later time, because I'm doing a lot of research into that right now. I'm asking questions, because I want to know, is that an option for women so that you don't have to have
because
surgery?
because you know the scare, the fear there majorly. Some people say, oh, not do this fibroid, you go die, and some people go tell the myths now. Some people go tell you, okay, this particular fibroid now, either village people they cause them, or maybe not something where you they chop they cause them, or now maybe not something where you don't do now in cause them. People get different reasons, different things where they talk. But coming from your angle as an expert now, what go be your advice to these people who go present this kind of reasons to you?
Okay, so the first thing is that we have to dispel all the myths.
Yes.
All those people they hear say, now because you don't do abortion, now it make you get fibroid.
Yes.
Or now your village people they follow you. Now the same way your grandfather commits, now in the God they take them out on you. Don't believe all those stories. Fibroids is just a gynecological condition. So another old midwife's tale is that fibroids develop in, what we know is that it actually develops, a fact is that it grows in women of childbearing age. So from as young as 13, or when a young girl has periods, she's capable of growing fibroids. That's the fact, right? So
yes.
Any woman of childbearing age can have fibroids. So one myth is that, fibroids only grows in women who are 30 and above. No. Or fibroids only grows in women who are obese, who are fat. No. I was very tiny, very skinny. I was a size 8 when I had fibroids. So I wasn't fat. Yes, sometimes people who are fat may be more prone to it because of certain things, but it's not just fat people who have fibroids, So when you understand all of those things, and you understand that fibroids, they are muscular in nature. So they are like benign, non-cancerous tumors that grow in the lining of the womb. And they can grow in any woman of childbearing age. Once you know that, once you understand that, then you can begin to find the right solution to it.
Okay.
Right?
So let's take... Go ahead.
Yes, I said don't believe all those stories that people tell you that, if you take, some people will tell you that if you drink something strong, an alcoholic drink, gin or whatever, that it will break it down. No, fibroids are like muscles, they are muscular in nature. In fact, I actually asked my doctor to let me feel it, the last one that I had, see what it felt like. It felt like, when you buy food or when you buy meat, there's a particular part of the meat.
This is Ishon, I'll be waiting that they call her. Ishon, yes.
Correct, babe. That Ishon, exactly. That Ishon, that is how muscular those fibroids are. You do that Ishon from morning till the next morning.
They're not a chew and finish, they swallow them like that.
Swallow, so the fibroids day. So imagine that you cannot use alcohol to break it down. All those things that they tell you, teas that they say is shrinking it. The teas can alleviate your symptoms. It will shrink you that has the fibroids, but it doesn't deal with the fibroids itself. So we have to find a specific solution to fibroids. And I understand women that are afraid of surgery, because obviously I've heard of so many women who've died having surgery. So I'm really a testimony, to be honest with you, because I have had 3 of those surgeries. In fact, I've had 4 major surgeries and I'm still alive and I have everything intact and I'm thankful to God. But before you subject yourself to any doctor for surgery, you have to be sure of the statistics of that doctor, that this doctor has performed this many surgeries and most of them have been successful. Obviously, there can be issues, there can be complications with every surgery.
Yes.
You understand? But you have to make sure that the risks of complication with that particular doctor that you're going to is very minimal.
Okay.
Right? And you just pray to God and hope that you are in the right hands.
Wow.
I always advise that before you get a doctor to do surgery on you, make sure that you have a connection with that doctor. When you feel like you are in the hands of God, when you're about to enter something dangerous, when you're about to do something and there's danger in it, there's something in us, like our inner man, our spirit man, tells you that this is not the right place. You can tell, you can feel it. Listen to that inner self. Don't just subject yourself to any doctor.
All right.
There's so much, to learn out there. Recently, people have started talking about, fibroids. Somebody like me, I'm talking about it because I do not want other people to go through what I went through. So just do a bit of research. There's information out there. Find yourself information. Get yourself equipped. An empowered and a knowledgeable patient is an empowered patient. That's what I always say.
Awesome. Lagos, they come back, and once we come back after this break, it's going to be time for you to talk to, or you could directly ask your questions. And I see so many questions dropped already, so we'll begin to answer these questions before we wrap up. Oyinkan, let me tell you also, aside from this particular time where they get now, we're going to need to revisit this issue next time. And next time when you go there inside the building, that maybe we're going to need to place a call to a doctor where they say don't do surgeries, don't do know about all those things. So you side by side, una go need to throw those questions to yourself. But thank you for being here today. We dey come back Lagos to still dey stream live. We dey on YouTube and we also dey on Facebook. Find us Wazobia FM. Na health corner be this. Today na fibroid we dey talk about.
For your matter, I go knock beat, sing song for your matter. I go praise the Lord, go to church for your matter. Treat you like a queen, there will be no other. I fit take a shot for your matter.
Truly pay attention, ladies and gentlemen. 95.1 Wazobia FM Obonge radio station. And we still get Oyinkan Ogundele with us on Top Health Corner. We they talk about fibroids. And all the things where we say you don't hear, make you drop them. So you go feel here, get fresh information on top this particular level. All right, Lee. So make we see the questions where we say they drop in here. Someone says, Oyinkan, thank you for coming and thank you for all the messages all the information you're giving us. But Oyinkan, please, I heard that fibroid had to do with what you eat. Is there a particular thing you can eat for it to stop growing? Somebody they ask you.
Okay, thank you. That's a very good question. So doctors have not told us specifically that this is what it is, but I from the research that I've done, I know that it's very important that you cut down on things like red meat. So, Nigerians, we're very fond of eating, a lot of protein, a lot of meat. In fact, you cannot serve a man food in Nigeria without putting meat in it, they always say. But as much as possible, try and cut down on red meat because meat actually does not digest that quickly. So apart from even fibroids, other things like cancers, because of that, you will cut down on red meat. You cut down on white starchy foods. So a lot of, the food that we eat that is processed, so bread, for instance, all the rice that is processed rice. You want to cut down on those things. If you have to eat rice, please put as much vegetables in it. Make it like a 50% rice, 50% vegetables. Put in a lot of, fruits and vegetables in your diet. Incorporate fruits and vegetables. A lot of us don't eat fruits. We're not very used to it, but we have to learn to start eating these things. Cut down on, foods that you warm in microwave, in plastic, because all of those things, there are chemicals in those plastic. We do a lot of takeaway food now. Microwave, we're in the microwave generation. As much as possible in your house, I've bought microwaves. I usually give them away because I really don't want to use microwaves to microwave my food. So as much as possible, cut those down. Try and eat healthy. I don't think that milk is good. For me, I always have a problem, with feeling bloated when I drink milk. I think that adults don't digest milk. I mean, this is my own theory. You can go and find out for yourself. I think that we have no business drinking milk at all. It just messes up with our system. So just try and watch your diet. Make sure that you eat healthy. Do a lot of exercise as much as possible. Try and keep fit, and try and, just drink a lot of clean water and sleep well as well.
All right.
Detox your mind. Stop thinking of all those things, issues that cause you to have, toxins in your body. All those things are not good for the body.
All right.
That's what.
So somebody they say, Cheche, you gonna need to teach Oyinkan pidgin very well. Yes, she they speak pidgin. She go they add them small. So back we go on top the phone line 0700 951 951 951. Ask your direct questions. Ask direct questions, okay? So go feel at least cover a little before we feel come out our mouth for here. Hello, Lagos. Good evening. Hello.
Hello, Auntie.
Yes, welcome.
Good evening.
Good evening to you.
Please, there is a question I want to ask also.
Go ahead, just fire the question.
Please, there is this kind of thing that I know, right? I don't think it's the thing, but I've been bleeding, this kind of bleeding that you said. I've been bleeding for, let me say, 3 years.
For 3 years?
Yes.
And okay, so you see a doctor. What did doctor tell you about this bleeding, or you don't see the doctor?
No, I go to scan. That time I was in Nasa. I even been the thing into Lagos here. I go to scan. Every time I go to scan, they say that there's a miscarriage. So I can't understand it.
Okay, hold on. I be want try to find out from her whether she do a scan and then she find out saying a fibroid she gets. Whether doctor tells she's been bleeding for 3 years.
3 years.
3 years.
When you say 3 years, is that 3 years non-stop or 3 years once a month? How is that?
Maybe she gonna need to call us back because her line be the break. Hello, good evening.
Hello.
Hi, good evening. Welcome, Health Corner.
Good evening, Cheche.
Hi, La.
Victoria, I just from Megbeda.
Okay, Victoria, fast.
Thank you for this topic where you just bring.
Oh, thank you, Victoria. Thank you, darling. Yes. Thank you. She's saying thank you for the information. Hello, good evening.
Hello.
Hi, welcome. Good evening.
Auntie Cheche.
Yes, darling.
Good evening.
Okay.
Please, I want to ask a question.
Go ahead.
What would be the cause of fibroid?
Okay, thank you. One question. What would be the cause of fibroid? Like the causes. Hello, good evening.
Good evening, sir.
Good evening, ma. Anyone?
I'm calling from Cheche, Kulele.
Okay, your question.
This is first time. I'm the first time I call out.
Yeah, first time caller. Thank you for calling.
Okay.
All right.
So I belong you.
Thank you. Hello, good evening.
Good evening. Please, I want to ask the woman whether she has children with all these surgeries.
All right. Thank you. Second question. Third one now.
Hello.
Hi, good evening, ma'am.
Good evening.
All right.
This is my person from Wazobia.
Thank you. Thank you for joining.
Thank God for bringing this her sister to Wazobia.
Okay.
I myself am a victim of fibroid.
Fibroid, okay.
Yes, but thank God that God helped me.
All right.
When I got married, when I got my first pregnancy, they said the fibroid was very big.
Okay.
That we should call for operation.
Okay.
So, by God's grace, my husband said there's something like operations, but God help us that I deliver that child.
What? How is the fibroid now? How is the fibroid now? You don't come out, Abi, you still get them?
No more fibroid. I used to born my 4 children.
And no disturbance, no disturb you at all?
No disturbance.
Good. Good. Thank you so much. Hello, good evening.
Hello, good evening. Cheche.
Good evening, sir. Welcome.
Yeah, my question is what can this thing cause if woman that doesn't have
children?
Doesn't see her menstruation
Okay.
on time at the age of from 21 upward, doesn't see her menstruation. What is the cause?
No, this is totally out of line. We're waiting with the talk about. Hello, good evening.
Hello, Cheche.
Hi, good evening. Welcome.
This is John. I'm calling for you.
All right, welcome.
Okay, this is the problem I have from my wife.
All right.
So before my wife deliver baby,
Yes.
it's very hard from her.
She get fibroid.
You get fibroid.
Okay.
The only one issue we get since that time to now.
Till now. So you people have been trying to conceive. The fibroid still there.
And it is still there, still they grow.
All right.
They stop every time.
Wow.
I don't know how to stop that thing.
Okay, but now don't go hospital. Waiting be doctor's advice.
Already, they said that the surgery.
Surgery. All right. So Oyinkan, back to you now. You hear the questions where they throw. Someone says after this so much surgery, do you have kids now? Another person asks, okay, the wife they get just one child now, and the fibroids still they grow, and doctor says the only solution is surgery.
Sure. Okay, I'll answer. Let me just answer that first question. The lady that called about bleeding for 3 years.
Yes.
Right? So that lady needs to go and see a doctor urgently because it is not normal that she's bleeding constantly for 3 years. So apart from fibroids, there are other gynecological conditions that could present with heavy bleeding. So it may not really be fibroids. It may be something else. So she really needs to go and see a gynae specialist very urgently. It's not normal. So she should not just sit at home and say that I've been bleeding for 3 years. It's abnormal. She's not the woman with the issue of blood. So that is not normal. So that's number one. Number two is that the person that said that they had I heard one person say that she had fibroids and she had 4 children.
Yes.
My mother had fibroids. She had 4 children successfully, no issues whatsoever. So like I said earlier on, fibroids would present in people differently. So for some people, it would affect them and they would have issues maybe with childbearing. For some, it would not affect their fertility at all. So, but you need to see a doctor to be able to recommend what you need to do specifically for your type of fibroids.
All
because
right.
fibroids grows in different places in the womb, right? What was the other question?
The other one said, were you able to conceive in the process of the surgery?
Okay, so I at the time that I was having this surgery, I actually was not even looking to conceive. I was looking to get my health,
to get yourself back.
There's a difference between being healthy and being able to nurse a child. A woman that is bleeding profusely cannot look after a child.
Yes.
So I wasn't actually looking for children. It's right now that I'm ready to have children. At the time, you could have given me children and I wouldn't have been able to look after them.
To take care of them. Yes. Yes.
So that's my answer to that.
All right.
Fibroids does not mean that you cannot have children. So, anyone that is still out there trying, continue to try. God will answer your prayers. with or without fibroid.
All right. Someone says, I really empathize. Of course, my mom also was injected with the same medication to shrink her fibroid. My mom had surgery twice before the drug was administered. And of course, however, the drug has a side effects, and of course, making bones to break, and of course, the fracture and every other thing around it. She now has to take a calcium and magnesium to supplement her daily. My mom was able to overcome fibroid when she got to menopause stage. Okay, another person says,
yes, that person's questions or our summary is fantastic. Yes, all of those side effects, hot flushes, because the medication actually puts you in a premenopausal state. So you feel hot, extreme heat, and extreme cold. So one minute you may be cold, next minute you feel like you're very hot, like you're on fire. It can also cause your blood to thin out. So your bone loss, bone density. So people like that will need a vitamin, to help with their bone. Yeah. So she's very correct.
Oh, someone they asked, is it possible to remove fibroid during CS?
No. So I'm not a doctor, but I understand that cesarean section is a surgery, right? And then you want to do a fibroid, take out a fibroid during that time. I don't think it's wise. I think it's best to do them separately, except it is obstructing, when they are doing that cesarean section. I don't think that they should touch it at all, because fibroids will cause the woman to bleed a lot. You don't want her to bleed to death, basically. So I don't advise. I'm not sure that's advisable, but you need to ask a doctor.
Wow. Someone said, "Oh, so sorry for your loss." She said she lost a friend last year during this fibroid surgery. She bled to death. Okay, I'm so sorry for your loss, darling. And lots of questions coming in here. Someone says, "Great topic. Thank you. Please, or you can come back. We're not done with this fibroid issue, right?" Someone says, "I had intramural kind of fibroid, and I had a surgery last year November, but I'm still waiting on the Lord for pregnancy." Okay. And someone says, "When is Oyinkan coming back? I can see time is going now. Oyinkan, when are you coming back?"
Please invite me again. I'll be back.
Oyinkan, thank you. I wish you can go on and on, but time no, they're always there on our side. But someone asks, please, waiting they cause this fibroid. I just joined now. Please, can she say it again?
Okay, like I said earlier on, doctors have not told us specifically what causes fibroids, but because you are a black woman, you have a tendency to grow fibroids more. Because if your mother had fibroids or your sister had fibroids, there's a tendency that you can also have fibroids. So the genetic predisposition and the fact that we are our race, our color, that we are black. And I also have a theory. I watch the creams that I skin. There are some chemicals inside creams as well.
So I heard that. I heard about that. The one you use for your hair, the one where you they rub for your body, the one where you they spray. I know. I did a little research to find out.
All those things, they interfere with the hormones, and they just mess things up. So you want to go all natural as much as possible. I'm not saying don't use perfumes, don't use creams, but when you use them, make sure that you read the content. Anyone that has sulfates, that has parabens, you want to stay off them, because they're like preservatives to prolong the shelf life of this product. But they're harmful to our health, and you don't want to be putting harmful stuff on your body. And then you want to eat healthy as well. Eat a lot of fruits and vegetables, cut down on red meat, and cut down on white starchy food. So all those meat pies, cakes, I'm not spoiling business for people who bake cakes, but try and cut down as much as possible.
Oyinkan, thank you so much. I wish we will go on and on, but you are definitely coming back. And of course, next time I go get you side by side with a doctor where we say don't carry out all these fibroid operations and surgeries, and then the doctor will answer why you also give your own account. Oyinkan, thank you for your time. Where the people go follow you on top social media platform?
Okay, on social media, on Instagram, there's My Gynae Issues, at My Gynae Issues. We're on Facebook as well. My Gynae Issues Foundation is on Facebook. You can follow me on Lady Oyinkan on Instagram as well. Yes, so you can look for us in those ways.
Wow.
Right.
Oyinkan, thank you so much. This time, no day enough again. Please, you come back. Have a wonderful evening. We love you from Wazobia FM.
Thank you so much.
All right, Lagos will take a break, and I'm so sorry. I apologize. I did sorry. No time. I apologize, guys. Will they come back?